The biliary tract cancer is very deadly disease. So even the current standard of care, which is anti-PD-1, anti-PD-L1 combined with the gemcitabine plus cisplatin, the response rate is below 30%. And the progression-free is about 7 months, and the overall survival only slightly exceeding one year. So the HER2 overexpression or orbital amplification is identified in about 15% of the biliary tract cancer patients, and is known to be related to the worst prognosis. It has became very exciting therapeutic target since there were many single-arm later-line trials. But the HER2 targeted strategies has never been evaluated in the first-line setting. So that's why I designed the HERBOT trial. The HERBOT trial is the multi-institutional single-arm investigator-initiated phase 1b/2 trial. The eligible patients included HER2 positive biliary tract cancer, metastatic, locally advanced, unresectable patients, which include gallbladder cancer, intrahepatic or extrahepatic cholangiocarcinoma. The HER2 positivity was centrally confirmed by the HER2 IHC 3 positive or 2 positive with EC positive. The patient received Trastuzumab plus Nivolumab every 3 weeks, plus Gemcitabine plus Cisplatin, and the Gemcitabine plus Cisplatin was continued until the cycle 9, followed by the Trastuzumab plus Nivolumab maintenance every 3 weeks. The primary endpoint was the recommended phase 2 dose for the phase 1b part, and investigator assessed confirmed objective response rate for part 2, phase 2 part. So about total 40 patients were enrolled and analyzed. Most of the patients had the ECOG performance status 1, and about 70% of patients had the gallbladder cancer, and 2/3 of the patients had the HER2 IHC 3 positive. The study met its primary endpoint with the objective response rate of 55% and the disease control rate of 95%. Response was durable with the duration of response of 12.6 months. After the 17 months of the follow-up, the median PFS was 10.6 months, and the overall survival was not reached at the time of analysis. In terms of safety, the regimen was well tolerated without any unexpected safety findings. We, as an exploratory analysis, we did the pre-planned serial ctDNA analysis and the AI-powered whole slide image analysis. So this represents also the AI-powered whole slide image analysis, which quantified the HER2-3 positive tumor cell proportion at the whole slide level, and also classified the immune phenotype based on the lymphocyte spatial distribution. Actually, the response rate was consistent regardless of the HER2 IHC status. But when we did the AI-powered whole slide image analysis, patients with the higher HER2-3 positive tumor cell proportion at the whole slide level, they had a greater response rate and numerically longer PFS. And also in terms of the immune phenotype, patients with the immune excluded phenotype had longer PFS compared to the immune deserved phenotype. So this kind of exploratory analysis, but it may help us to better understand the HER2 biology and its correlation with the tumor immune microenvironment in the biliary tract cancer, and may refine the feature of patient selection. So overall, the HERBOT is the first prospective study to demonstrate the feasibility and the encouraging activity of the HER2-targeted chemoimmunotherapy in the first-line setting of the HER2-positive biliary tract cancer. This trial research support us to integrate the HER2-targeted strategies in the earlier treatment line, and also provide a strong rationale in the currently ongoing global phase 3 trials.